Hearing your child's first word is one of the most highly anticipated moments for any parent, and the ability to communicate effectively with others is the very foundation of a child's social, emotional, and educational development. As an early childhood speech-language pathologist, Lynda Martyn provides assessment and clinical interventions for newborn to school-aged children who have communication disorders of all types, from language delay to articulation difficulties to autism spectrum disorder. The work is challenging and rewarding, and as one of only 3 interior health speech-language pathologists providing services for young children in Kelowna, it should come as no surprise that Lynda maintains a full caseload. This in itself would make Lynda a worthy nominee for a Healthcare Hero Award, but it's not why she was nominated.
Lynda's role at the Community Health and Services Centre in Kelowna involves seeing children from birth to school entry for general speech-language pathology needs. But as well, she has a particular interest in serving families who have children with cleft lip and palate. She has driven this as a passion project for 22 years now, organizing and coordinating the cleft palate clinic, seeing that all families in the interior of BC have access to a specialized clinic like this.
The clinic is held 4 times per year, with Lynda arranging for a plastic surgeon, ENT, audiologist, dental hygienist, pediatric dentist, orthodontist, and pediatrician to gather in one location to see families with children who have cleft lip and/or a cleft palate. Lynda herself provides services as the speech-language pathologist.
When a family comes into the interior cleft lip and palate clinic, they get to rotate between all of the different professionals here at the clinic. And then at the end of the morning, the team meets together and we discuss our findings and recommendations so that at the end of the morning, the parents can come in with their child one last time and hear our advice as far as timing goes for the different procedures, and any questions can be addressed that the parents might have at that point. I organized the Cleft Palate Clinic because it creates such a nice opportunity to use the expertise we have here in the community so that families don't have to travel all the way to the coast in order to receive the service. For a lot of families, it means that they don't have to leave their jobs, so it's quite a large undertaking to go to the coast for a lot of families. So having people even from the Boundary or East Kootenay areas come to Kelowna, it's much more manageable for them. They can see that we're going to help them and support them through all of the different years of their child's life.
Over the past 22 years, hundreds of families have received services through the clinic, which would not exist if it weren't for Lynda's efforts and commitment. Lynda, for ensuring that children across the BC interior have the opportunity to benefit from the best possible care for cleft lip and cleft palate, you have been named this year's Healthcare Hero for Interior Health, generously sponsored by Pacific Blue Cross.